Start.
Good evening, dear doctors. On behalf of National Institute of Clinical Excellence Homeopathy, I, Dr. Shilpa Satish, extend gracious welcome to all of you for the fourth session of Hidden Treasures of Plant Kingdom. As all of you are aware, these learning sessions are arranged as we mark the 10th year celebration of our institute. We have come up with a very interesting topic for today's discussion, that is, role of plant remedies in fevers. Today's session will be moderated by Professor Dr. H.L. Swami, Founder, Director, National Institute of Clinical Excellence Homeopathy, Chairman, Karnataka Qualified Homeopathic Doctors Association, a passionate teacher and a classical prescriber with 30 plus years of experience in treating various clinical conditions ranging from autism to Alzheimer's. With this very brief introduction, I now call upon Professor Dr. H.L. Swami, sir. Sir, over to you.
Thank you, Dr. Shilpa. Shubha Sandhya. Good evening to everyone. So, as we all know, and even she also told, as a part of our decennial program, we are arranging this free lecture series. And in that, this is the fourth one. Last 3 sessions, we had a varieties of cases we've seen from the plant kingdom. Starting from Tuja, the evolution of Tuja, and the Arnica, the different dimension of Arnica, including the other, with comparison with other injury drugs, and different facets of pulsatilla, different cases of pulsatilla we saw. So today we thought, let us do something with the disease-oriented or therapeutic-oriented topic. So we took the fevers because fever is the one which is most common symptom we come across in our clinical practice, isn't it? So here I wanted to know, the moment you hear fever, what it will come across to your mind. Fever means stuck. What it comes first.
You can put it on.
You can unmute and or you can put in chat box. You can unmute and talk. No problem.
Temperature. Body temperature.
Temperature. Very good. Anupama puts. So fever means aconite. Fever means cause. Okay, good. So body reaction to the germs. Chills. Okay. Defense mechanism. Good. Body ache. Chill and body ache. Fighting with WBC. Fighting with WBC or fight? WBC will fight.
It's fighting along with the WBC maybe, sir.
Along with WBC. Fine. Good. Fight along with WBC. Good.
The mode of onset.
Delirium. Temperature. Okay. Now what I'm asking is, moment you heard fever, for example, somebody calls you, Doctor Sahab, mera beta ko, beti ko bukhar hua hai, I am coming. What it just comes to in your mind, moment you heard this one? Infections. Very good, Ashwini.
Type of fever.
Huh? Type of fever. Okay. So that is, once they come, then you are asking. What asking the question is, what it comes to your mind? Okay, fever, asan case hai. Arey, fever, how I handle? You got it. What it comes? In that manner I am asking. So try to work out for the cause for fever. Good. Okay. Body immunity fighting. Good reaction, viral bacterial infection, type of fever. Okay. So next slide. Reason for fever. Same cause, reason. Okay, good. The fever is the second most common complaint suffered by the human beings. I don't know how many of you read Harrison internal medicine textbook. Anybody? You read Harrison for medicine, internal medicine textbook?
Yes, sir. During internship days, I have learned.
Acha. Are good. You tell me where in the Harrison fever chapter comes. Who is this?
Dr. Shravani.
Dr.
Sir.
Shravani.
Yeah, sir. Yeah.
So it comes in epidemiology, sir. Tropical fevers.
Who told this one? Kulkarni.
Dr.
Preeti Kulkarni, no?
Yes.
Preeti Kulkarni saw read Harrison in my clinic only. Okay.
No, sir.
Good.
During final year medicine, sir, at that time.
Medicine you read, huh? Then,
Yes, sir.
then,
Yes, sir.
then I should ask who passed you. It is in the
Clinical.
it is in the second chapter. Second chapter, cardinal symptoms of the cardinal symptoms. In that, first is pain, second is fever.
Fever.
After the pain, most common complaint or most common symptom is the fever. Next only to the pain. Pain is most common. All of us come across one or the other way some pains. Okay. Some pain, there is a treatment, some pain, there is no treatment. But pain is common. In same way, most of us, one or the other phase of our life, we come across with the fever, isn't it? We all suffered, no? We all suffered fever. I don't know anybody is there who are not suffered fever. Previously, there was one saying. It is to say that at least once in a year you should get fever, otherwise you are not healthy. Anybody heard this one?
Yes.
Sir.
Yes. Why?
No.
Why they used to tell that at least once a year you should get fever?
Our own immune
To
system.
check the immunity. Own system works well, it indicates.
Huh?
It indicates our body's fighting capacity, sir. Immunity against any
To check the
infection.
immunity of a patient.
It is a testimonial that your body has the fighting capacity. Fighting capacity, immune system is good. Your body reacts to against. But why this proverb came? There is one continuation is there. I don't know if you know it or not. Once in a year you should get a fever. If you don't get a fever at all, then you will get mad. You know this one? You know this? Anybody knew this one?
No, sir.
It is ulta. Mad people will not get fever. Mad means the schizophrenic and all, very rarely they get fever. So in that context it came. But generally fever, mental illness, correct, mental. So fever denotes that, it shows that your reactive power is good. Body reactive power is good. So once in a while, not that like a corona, but once in a while if you get little temperature, it is good. And you all know it, fever is not a disease. Fever is a symptom. So fever is a symptom. When there is a fever, you should know what is the reason behind the fever, why this fever is coming. Okay, just you have fever, you take antibiotics. That is not this thing, because you are stopping body's expression. It is telling, it is showing, it tells, take care, there is something problem. So it's a reflection. It's a symptom. Observe. So that's why the over-the-counter medicines, fever medicines, taking this thing, giving medicine for the fever, simple, just for a fever. Don't do it as a routine. Don't take it, especially these antibiotics. You know it, majority of the antibiotics has a lot of side effects. It looks very simple, no? One crocin, क्या होता है भाई? Paracetamol? No. It has, unless otherwise indicated, it is necessary. Don't. Some people are made have an habit of, especially in the children. Not only resistance, it is not the resistance problem. It is a hepato or renal. It affects either liver or the kidney, either hepatotoxic or renotoxic. Majority of this thing is renotoxic. I got in my clinic several cases, especially children, of the acute renal failure followed by fever, and they give paracetamol. They bring after 2 days, 3 days, child is not passing urine. This is very dangerous. In fever cases, just by suppressing the fever, giving fever without evaluation. So in common, no, in house, you keep paracetamol syrup and de do. Har 4 घंटे में de do. And without compensating the water, dehydration. In fever cases, always plenty of water is required along with your indicated medicine, rest and hydration. These two are important. If there is no proper hydration, it may lead to acute renal failures, especially in children, because their body surface and body weight has lot of disparity. Okay, this is the take home whenever when you think of fever. These are the things you should keep it in mind. I'm telling in the beginning, general fevers. Okay, not all fever need to be treated with medicine. Sometimes just rest and hydration. So actually, there was some university, I think Cambridge or something university in the UK. So they done lot of research or work on the influenza fevers. Then at the end, the dean or the in charge of that one, he concludes there is no proper medicine for the fever, or especially the influenza one. The rest and hydration, foremost is, at least the next one is, the best one is Indian rasam. So many times that itself will be like a treatment. Otherwise, most of the drugs are giving adverse effects than the beneficial. What he talks was the allopathic one. Even that was published in BJ, British journal. So this fever, not all the fever, doesn't mean that you neglect it. You have to take care, observe, treat. Our medicines, especially the medicines from the plant kingdom, very safe to give. Very safe to give, very mild. All homeopathic medicines are mild, don't worry. Okay, but these things I'm telling not only as a physician, we are also as a parent. We have no anxiety. Thoda bukhar ho gaya, immediately give 1 dose of aconite or belladonna, doesn't come. You start with the paracetamol. Don't do it. Don't do like a routine this thing. Okay, not required. Try to find out the cause, or try to find out the reason. One of my patients, he was in Australia. He had pyrexia of unknown origin. He admitted there in the hospital. Can you believe it? He was there in a hospital for more than 2 weeks. 2 weeks. Not even a single pill is given, single tablet is given, because they could not find out what exactly the reason. It was hydration, rest. He was telling, sir, in India, it would have, by this time, they would have given 3 different types of antibiotics, antipyretics and all. We are just discussing about how does this one. more than 2 weeks, more than 15 days he was in the hospital. They did not give even a single tablet. They wanted to find out the cause and this thing. See, that is so many times. So finding majority of this thing, there is investigations and other things, we can make out the diagnosis. But without the proper this one, don't jump and don't give routinely these antipyretics. Okay, next. This, I think most of you agree. Sometimes fever is a protective mechanism. Here I wanted to tell one case where I don't know how many of this, around 10 years back, chikungunya was very common in Bangalore. Lot of cases of chikungunya we see. One observation we made in our clinic is patients who are all come with fever to our clinic, their body pain, joints pain resolved much faster than the patient who come after taking the paracetamol or after fever is reduced. So many times.
Sir,
fever
repeat,
itself-
sir.
Yes, ma'am.
Sir, once again, repeat, sir. Not understood.
See, in chikungunya cases, I saw the cases
sir.
which came to my clinic during the fever phase. Their treatment or their cure, even clearing with all the joint pains, was much faster than patient who come after taking the antipyretics where the fever reduced, then they came followed with, sir, last 1 week we have this one. I took 3 days, 4 days paracetamol, now fever reduced, but joint pain is more. That was taking more time. Even I saw few cases, even after a year, 1.5 years, 2 years, they used to come with the joint pain telling that last year I had a chikungunya, fever reduced, but it is after this some medicines, but pain remained. In those cases, fever itself is a defense mechanism. Because of body high temperature, most of the viruses will not multiply much faster. At that time, without handling properly, just give only to reduce the fever, it would have backfired. Lot of cases. You got it? How we are now getting patients loss of smell, loss of taste, even after the COVID, after 1 year. Recently, last week also I got one patient. So 1.5 years back, she had COVID, still her smell and her taste not come back. Taste little bit, but no smell. You got it? So many times, fever protects. It checks the viruses. So on that basis, fever is a protective mechanism. Okay? See, why these are the things, whenever a high ear fever, these are the points it comes to my mind. Okay? What I asked in the beginning question, when you heard fever, what it comes? Fever is a symptom, not a disease. All fever need not to be treated with the medicines. And fever, so many times it is a protective mechanism. It is most common complaint, next only to the second most common complaint, next only to the pain. Okay. Now coming to today's topic, plants are major sources of homeopathic drugs in general. And for fevers, it is one of the almost 90% of the cases or 90% of the drugs what we use for fever belongs to the plant kingdom. More than 80%, 90% almost. So role of the plants in fever cases is much higher compared to the other source of drugs. Okay. So let us start with one case now. So I call upon Dr. Anusha Matthew. She is a senior homeopathic doctor practicing in Bangalore. And she is our core committee member for the NICE. She is a coordinator. And wonderful human being. So I called Dr. Neha. Anusha. Dr. Anusha Matthew.
Yes, sir.
Yes, Anusha.
Yeah. So I
You
had
brought
a
some case, no? Some interesting case.
Yes.
Yes.
Yes. So I had a case, a 45-year-old male. He presented with feverishness and body pain who came to my clinic. So his ailments, he said, after he got drenched in rain 2 days back while he was driving back home on a two-wheeler. So presenting symptoms, what he said was he had fever, 99 degree, thirst 2+, chills, headache, restlessness, and severe body pain. So these were the presenting symptoms that he came with.
So
And
what
on
do you think when patient comes with fever, mild fever, okay? It is less than
Yes.
100, with chills, headache, restlessness, body pain. What do you think? What may be the cause? What may be the diagnosis? Remedy, acha, directly remedy, Rustox. Acha, good, okay. Any other remedy or the probable diagnosis? Why Rustox, Neha? Belladonna,
Drenching rain.
Deepa, why belladonna? At least you give one indication.
After getting wet in rain, sir.
After getting wet in rain, very good. That's why Rustox and belladonna.
Ravindra, sir, you can unmute and talk, or you can put it on chat. You've raised your hand.
Okay. Okay. So what may be this thing? Cause for the fever, diagnosis, provisional diagnosis?
Anyone
That is
wants
fine.
to answer, you can put it in the chat box.
Huh? Yes, sir. What may be the cause and the diagnosis, provisional diagnosis? Cause is after drenching in the rain. Somebody told viral I heard, not completely. Okay. Next slide, Anusha.
Yeah. So I gave a remedy based on the presenting symptoms. I gave a remedy for 3 days. Okay,
Allergic rhinitis. Okay, good.
So
Now
after
you see.
yeah. So after giving the medicine, the next day the patient sent this photo. He said he has rashes on his body. And the first day, the photo what you see in the left side is the first photo that he sent on the first day. Then the next day he sent the second photo. So these were the rashes that came up after the medicines.
Now you tell me. Viral.
Anybody wants to tell what was the diagnosis? You want to tell what it is?
What's the provisional diagnosis? See the rashes. Articarial rash. Okay, good. You just little enlarge and see, you can make out a little better. Okay. Type of rashes. Then
Bullous
erythema. Okay, good. Then yes, somebody raised their hand.
Ravindra, sir.
Namita, chickenpox. Very good. Acha. Sandhya, herpes. Beautiful. Okay. Polluted rainwater. Okay, good. Nishi. Yes, Anusha.
Yeah. So
Continue.
what I gave him was, the medicine what I gave him was Rustox. I gave him Rustox 30 TID for 3 days. So based on his presenting symptoms, I had given Rustox. So initially I was thinking of belladonna, like some of you all mentioned here, but because the temperature was very mild, and on examination his throat was very normal, and I saw that he was extremely restless with severe body pain. And also it was only after 2 days after drenching in rain that he started with the symptoms. So then I thought Rustox should be given. That is better than belladonna. That's when I started Rustox. But it so happened that the rashes developed the next day. Looking at the rashes, both the patient and myself, both of us got to notice chickenpox. So I did not notice chickenpox when I started off with Rustox. But later on, I felt the medicine is okay because we have a similar classical symptom seen again in Rustox: vesicular eruption, severe itching, the reddish skin. So looking at all that, I thought, fine. And then after 2 days, the patient's wife comes back saying that he's not able to talk. He feels there is some mucus developed in his throat with a severe pain and he's not able to talk. So all his symptoms, he sent me through a message over the phone, and she comes to ask me what should be done. And the wife said that he's in a state wherein he can eat, but he cannot talk. And she said there is no fever, his body pain has come down, his restlessness has also come down. That's when I thought of the next remedy to be given, which was
What do you think in this stage? See, where fever is reduced, body pain is reduced, rashes all came out. Once rashes comes out, naturally the restlessness and other things are reduced.
Came down.
Now, after 2-3 days, he developed the cough, phlegm-like feeling in the chest, heaviness, and that it aggravates, that heaviness of the chest aggravates when the talks. Any indications, any drug? Heparsal, good, heparsal, okay. Placebo, right, good, very good.
Antim-tart.
Antim-tart. Who told antim-tart?
Dr. Shravani.
Shravani. Shravani, good. Ach. Antim-tart. Praveen. Sir, namaskar. Praveen sir. Good, good. And Lata madam, namaskar. I saw Lata ji joining this. Thank you. Thank you very much. So, yes, Dr. Anusha, continue.
Yes, as some of you rightly said, it was antim-tart. I gave antim-tart 200, 2 doses. And so initially I thought I will give placebo, but the patient's wife is like, let the rashes come out. My relatives told and everybody told it's better not to take any medicines. So just give me something only for the throat. So even I thought no need to give PL, and only antim-tart 200, 2 doses were given. So vesicular rashes came up all over the body with itching. Diet and hydration was explained, as he felt very weak, dizzy and drowsy sort of a feeling. He was complaining. So after antim-tart, the throat symptoms came down and he was better with that. And you can put the next slide. So scabs formed and it dried within 10 days and there was no infection. So everything was fine. So as you all know, post chickenpox, once they take bath and everything, the patient will come back to the clinic saying that there are a lot of scars. Can you do something for the scars? So will it go? And these are the questions that come. So that's when I thought of Thuja, because as you know, Thuja is thought of whenever there is an inflammatory process, either after an injury or an infection. And if there is a scar tissue, so we can think of Thuja. It is a very good remedy. So Thuja 200 was given, 2 doses for fading and also to prevent the deeper scar.
Isn't it wonderful case? Good, very good, Dr. Anusha.
So these are the few things you know, all of you all know. So it is caused from varicella zoster virus, and the reactivation of it causes herpes and shingles. which is seen to be quite common of late post-COVID. And the symptoms, again, fever, fatigue, pharyngitis, headache, rashes starting on the trunk or the face and follows all over the body. Symptoms begin 10 to 21 days after exposure to virus. This is very important because sometimes people come with chickenpox and they tell there are people back home who've not got chickenpox. So they will ask us for the prophylactic remedy. So that time we need to tell them that if you get exposed to it, so within 10 to 21 days, you might get an infection. So, and you can think of the prophylaxis. Complications can come like pneumonia, encephalitis, bacterial infections. Generally bacterial infections due to itching, route of transmission, respiratory tract or direct contact. Therapeutics, you can think of variolinum, belladonna, sulfur, pulsatilla, dulcamara. Of late, chickenpox is seen in all climates, which was not common earlier. Earlier, we used to see chickenpox only in humid and summer climates, but now it is there in all climates. Especially if it comes in monsoon, it is very difficult for it to dry. So it takes quite some time. Probably the vaccination in kids for chickenpox and low immunity could be the reason for this. Once infected, it rarely affects again, but again, low immunity can bring on herpes. Most of you might have seen in your clinics post-COVID vaccination, many of them came up with herpes. And when asked, when questioned, they said, we had got chickenpox in childhood.
And there is a question, is there was an exposure for the virus for this patient? Any of his family members had the chickenpox or friends?
No, nothing that he knows
Nothing.
of, sir.
Not,
No.
at least he not narrated that. Okay?
No.
Okay, good, very good. So Arshita, I think your answer, this thing is answered. Thank you,
Yes,
Dr. Anusha,
Thank
for
you, sir.
wonderful case presentation.
Thank you, sir. Thank you.
So we'll move further. So what are the factors to be considered when in the fever cases? Okay. See, so many times the onset itself will give some indication for the some remedies. Fever sudden in onset. Which is the medicine? Sudden onset.
Aconite, sir. Aconite, belladonna.
Aconite, belladonna. Very good, beautiful. Okay. So these are the drugs which where the fever sudden in onset. Suddenly it comes. It is not like what the case she told, he drenched 2 days back, then it came, nothing. It is here immediate, sudden in onset. Even phosphorus, sudden in onset. Okay. So you know how to differentiate between when they drench in rain. So or the exposure to rain. Which are the remedies? One is Rustock, she told.
Dulcamara, sir.
Dulcamara, no, okay. Dulcamara is more of a the wet flooring.
damp weather.
It is the belladonna, where they exposure, they take cold from the head. Take cold from the head. In Rustock, they take the cold from the body, especially the lower part of the body. Which is the drug they take cold from the chest? It's raining, they had the helmet, they had the shoe,
Phosphorus.
but
Phosphorus.
exposed the shirt, there was no jerkin, jacket. Bryonia, no.
Phosphorus, sir.
Phosphorus, beautiful, phosphorus. They take phosphorus. In Heparsal, it's a cold air. It's a cold air, cold breeze. Okay. So onset itself will give like exposure to cold breeze. So Heparsal, exposure to rain, that took the cold from the chest, phosphorus. So many times these factors will help in identifying the remedies. Okay. Next, type of fever. What are the different types of fever we know?
Intermittent fever, sir.
Intermittent, continuous. Okay. So we have remedies, no? Continuous fever, remittent fever, typhoid fever, like a arnica, bryonia, rustox, like that one. Intermittent fever, like a malarial fever type, Syncona, China sulf, so nitramure. Okay, so like that one. Phase, what phase? Chill, heat, thirst, sweat, all that. What phase? Basically 3 phases we know: chill, heat, sweat. If all the 3 phases equal and it comes in this systematic manner, first chill comes, then fever comes, then sweat comes. Which is the remedy? All the 3 in the same intensity, in the order.
China.
China or Syncona. Good. China, Syncona, and China sulf. There is a chill, but no fever, or less fever. High chills, severe chills, followed by mild fever,
Gelsemium.
then sweat. High fever, high chills, low fever, no thirst is pulsatilla. Ulta. High
Pardon,
fever,
sir?
low chills, no thirst. Which is a drug? High fever, chills is very small, or no chills, or mild chills, and thirst, no thirst. Opposite is ipecac.
Gelsemium.
Ipecac. In gelsemium, chills are very predominant, but fever will be there. No thirst. Thirst is less. Thirstless remedy. Gelsemium, pulsatilla, ipecac, these are all thirstless remedies. Okay. There are few symptoms. This one only fever is there. Dry fever, or somebody should know. Dry fever. Which are the remedies? Dry fever, no sweat. Bryonia, better than bryonia. Epotorium perforatum. Okay. Sulfur. Belladonna, but belladonna usually have sudden rise of fever, high fever. Okay. So phase also gives the hint to select the remedy. And modifying factors, modalities. Okay. So causation. What caused? What made? Like in this case, rain, exposure to rain. Okay. Causative modality, or aggravation, or amelioration. See, what is mental symptom for the chronic cases? For acute cases, modalities placed like a mental symptoms. This will gives lot of hint for selection of the medicine. In acute cases, modalities are very, very important. It will become a characteristic symptoms. Okay, like how we treat mental symptoms in the chronic disease. Associated symptoms. Along with fever, what are the associated symptoms? Okay, is the infection in the throat? Okay, like tonsillitis, or infection in the lungs, pneumonia, or there after a burn, after a after an injury. These associated symptoms also plays a major role. Along with that, even concomitants. Sometimes concomitants makes the selection of the remedy very easily. And if at all there is a concomitant, in those cases, always give weightage for it. It will be the decisive factor to select the remedy. Especially if there is any mental symptoms as an associated symptom. Like in this case, restlessness. It's the associated symptom. High restless. It's a mental symptom. It was not a part of the disease. So this concomitant plays a major role in selecting the remedy. Laboratory investigation, so many times, sometimes what happens when there is no clarity, this laboratory investigations also helps in selecting the remedies. For example, there is the fever, anorexia, no interest in eating, loss of appetite, very all common symptoms will be there. You don't know this thing. At that time, if they bring the lab report where the liver function test, SGOT, SGPT was high, what do you think? Okay. So at that time, you know that it is a hepatitis. Still, the jaundice symptoms may not be, so onset of the yellowness may not be just come. But with that help, you can think of the remedies which has strong indications for the hepatitis, isn't it? So many times laboratory investigation, especially the hepatitis B type of things and all. So we have certain remedies which has a very marked action on the hepatitis B. Anybody can tell which is the drug for hepatitis B?
Justicia, sir.
Chelidonium, sir.
Justicia.
Okay, Justicia. Okay, Chelidonium. Chelidonium more on the liver complaints, but okay, Chelidonium in on that basis. Here, Chelidonium is more helpful in hepatitis A than the hepatitis B. Baptisia, okay, Baptisia also. Phosphorus, yes, phosphorus is more indicated in the hepatitis B. Pyrogenum, if there is some indication for pyrogenum, yes, we can think because infected, but much more this thing is phosphorus. Okay, good. And diagnosis, as I told you, same thing. Whenever there is a clear diagnosis is there, we have some group of symptoms. So the group of remedies, for example, if it's diagnosed as the dengue fever, so dengue, where the platelets count started reducing. We have set of remedies, no? We have set of remedies to think. So this thing for the dengue fever. So like Equatorium perforatum, beautiful Equatorium perforatum. There are a lot of remedies are there.
Crotalus horridus.
So anybody can suggest which is the remedy which improves platelet counts, fever and all after reducing?
Crotalus
Lachesis,
horridus.
Crotalus
Lachesis.
horridus.
More than lachesis? Crotalus horridus. Carica papaya, homeopathically, I have not seen in my practice because Carica papaya, what we use is not from the leaf. It is the unripened papaya and seeds, with seeds. It is a fruit and seeds. You should know the source of medicine, then it will be easy. Just because papaya, don't give Carica papaya. Because in Carica papaya, it is, leaf is fine. Leaf, I don't know any remedy is prepared from the papaya leaf in homeopathic, this one. Carica papaya is not from that one. Carica papaya is used in the raw fruit, okay, with seeds. Better than that is Sanguisuga. I don't know how many have heard. Sanguisuga. Anybody knows Sanguisuga?
No,
Yes,
sir.
it is from the
Spelling,
leech.
please.
It helps. Sanguisuga, Crotalus, all these drugs will help. Okay. So again, indication is the thing. We don't have any specific for any condition. Homeopathy is only on indications. Okay. So here we'll take up again one more case, few more cases to understand the with case the reference will be much easier. I call upon Dr. Neha. She is a senior practitioner from Uttar Pradesh, and she is a core committee member of NICE. She is one of the beautiful coordinator. Neha, you are in Uttar Pradesh, which place?
So Kanpur.
Kanpur. She is from Kanpur. I present Dr. Neha here to present the second case of the fever.
Thank you, sir. Good evening, all of you. This is my case of a male patient of age 31 years, visited on 12th December last year, 2022. And he complained of constant sneezing since the month of May. And he came from long distance from Unnao, that is quite far, 50 kilometers from Kanpur, and he came He's an owner of dhaba and he runs a dhaba. Basically, he's a pharma student and has done job in Bangalore, but he was not satisfied with that thing. So he came and started his business here. And what complaint was disturbing him was blocking of his nostrils while lying down, mostly left side. And because of this stuffy feeling, he was not able to sleep even. So he has used, because he was a pharma student, so he himself took this nasal spray Otrivin, and he was using since May until he came to me and said about this thing. And along with this stuffiness, he was having feverish feeling, and he said that he catches cold every week. Like he's once he's having fever, and he takes some medicine, some anti-allergic, and after a few days again it relapses. Again he starts sneezing in a violent manner. So on examination, but when he told that he's suffering since last 6 months, then I auscultated him, but his chest was clear. But in rails and bronchi was present that some sound was coming in his breathing, along with his breathing. So this I have done, but nothing specific I got. So after this, I came to his personal generalist. Appetite was normal. Desire was sweet and spicy. Food habits, he is a vegetarian. Addiction, he was addicted to tobacco. Here, people used to take gutka. It is called in local language gutka, tobacco chewing. And sleep was disturbed again because of this nasal blockage, and his thermals were hot, as he also said, and I also observed that in the month of December here in Kanpur it is very chilly, but he was only wearing a single shirt, not having any coat or jacket. He was very hot. Sweat, he said that he is having more on forehead and back, and stool were clear. When I asked about the family history, his father died because of chronic kidney disease and diabetes, and mother recently had undergone knee replacement surgery. His paternal uncle was suffering from tuberculosis. Next. So on when he came, it was 12th of December. So can you guess what medicine would I have given to him on that day? You can write in the chat box or unmute.
With this history, what are the drugs you think? Tuja. Beautiful. Tuja. Naxwamika. Why Naxwamika?
I trust this.
Hydrastis. Acha, acha. Okay. Tuberculin. Good. Silica. Very good. So, Dr. Neha, you see what she gave?
So I gave Allium Cepa 203 doses on a single day, and followed by Seclac for 15 days. Since he was from quite long distance, so I gave this for 15 days. And after that, he came to me on 26th of December, and he was little bit better, not much. 20%, he said that only 20% he was quite better. Feverish feeling was gone, but the stuffiness was still disturbing him. And on that day he informed me that he is having anosmia. He is not able to smell anything. He is not having any sense of smell, and at that day no fever was there. So this was the thing what he told me on follow up. When he said about anosmia, then I inquired, I examined his nose. So on examining the nose, this was a thing which I forgot to examine in the first visit, that I have to examine the nose also. So in the second visit, when he said of informed me about anosmia, then only I examined his nose and saw that uh, the there were polyps in his nostrils. So on 26/12, I gave, I changed the remedy, and I gave Tucrium merum verum 30, and that was twice a day. And along with this, I gave 3 doses of Seclac and one PLO in tablet form for night. So yes, this is Tucrium merum verum. So this I gave, and on 18th January he came with along with his brother, that he's absolutely fine, and he didn't told me he came with his brother and said that doctor, I have to show him. So I only inquired him that are you okay? He said no, I am absolutely fine, and it is vanished. All the problems, all the things, stuffiness feeling in the nose, and his sleep is also quite sound now. So I advised him that I have corrected you, but you please maintain this thing along with this advice I gave him to do pranayam and to take steam inhalation whenever possible, because he was exposed to pollution, because he was a dhaba owner, and dhaba is a open kind of restaurant, so there a lot of dust is there. So I advised him to, whenever he can do, he should do pranayam regularly and steam inhalation whenever possible. So this was my case. Thank you all of you. Thank you, sir, for giving me this
Thank you,
opportunity.
Dr. Neha. It's a wonderful presentation, beautifully explained, and you admitted. See, I did not examine the nose in the beginning. See, that is a
Yes.
good thing. See, that's how we should learn from our mistakes. And it's a wonderful case, beautifully this thing. And to Kriyam, you all know, it's a magical thing. So whenever they, and that person avoided the surgery. Otherwise, it would have been the surgical case. So the Dr. Neha corrected the complaint without surgery. Our homeopathic remedies has the beautiful action, and even the surgical disease can be treated non-surgically with our medicines. Okay, so Tucrium, very mild plant, but see how beautifully it is helped the case. Thank you very much. I call now Dr. Shilpa Satish, a senior faculty practicing in Madhepur, Bangalore. So she is the one of the founder member of NICE Institute, and as Patel sir always keep telling, super faculties. There are two super faculties are there who controls even us. So that she is one among them. I call Dr. Shilpa to present her case.
Yes, sir. Thank you, sir. So this is a case of a boy aged 8 years who came with complaints with of fever 101 degree Fahrenheit, and he also said that he has throat pain 2+, aggravation swallowing, whether it is liquids or solids, and had cold, nose block, and coryza. Nose block and coryza would alternate. Coryza's nature was thick, and he told that he had difficulty breathing through nose at night. And then when taking history, I got to know that he had recurrent episodes of fever, tonsillitis, cold, and coryza. And recently, they've moved to London from when the condition has worsened. And also, when taking personal history, we got to know that his appetite is very less and he's a picky eater. And thirst-wise, he was thirstless. Perspiration, he would easily perspire when in India, but when as they've moved to London, he doesn't perspire much. And thermally, he was more predominantly a chilly patient. So this was how his throat and his tonsils looked when on December 23rd, 2022. Okay. And one interesting, thing with the patient was the consultation was all through online because they had already moved to London. So with this basic information, any remedy suggestions? I think I saw Dr. Sri Priya already suggested silica. So any other?
Alien Sipa, ma'am.
Allium Sipa. Okay. Naxvomika. Hepacil. Yes. Okay. Next slide. So the thing is, like, even though they consulted me like on 23rd December, the medicines only reached them on 5th Jan 2023. So initially, like one of the doctors said belladonna, even I had thought of belladonna, but only the distant constant, and by the time the medicines reached their place, that belladonna stage would have passed. With that reasoning, I had to select remedy which is more deeper than belladonna, and this was why I gave Hepacil 200, 3 doses 1 day followed by placebo. And in between also, till even now, till now, they are in contact. I've just mentioned few follow-ups where I have made some changes. So 8th Jan only they told like tonsils are better, and he mother just complained that he had coryza, which is thin and watery. So we just managed through biochemic Kali muraticum 6x. And then in between also small follow-ups were there, and we always put him on placebo. And 1st May again they told like he had throat pain. On examinations again they had sent me photos, so tonsils were red but not much swelling this time. This was when again we gave him belladonna. So belladonna this time was given 1 mg potency, 3 doses for a day followed by placebo. And since they are distant patients, so their follow-ups are with photographs. So it is better for us also to keep with us for the record. So these are the few pictures that the mother kept sharing whenever she felt like her tonsils. And one more thing was, mother is nurse. She's working in London hospital. So that is how she could give me a better picture of his son's condition. The condition on 25th is seen here, and 2nd April is seen. And the last recent one on 8th August also she sent. Immediately after moving to London, they had scheduled for ENT appointment after some time, but they only got it few days back. And when I was preparing for the presentation, I just asked how he was doing. That is when she sent me this WhatsApp message that his tonsils are completely fine now. Even with the ENT consultation, they also said like there are no complaints as such, and she's been thankful. So this was the case which I got to treat with a distant patient on an acute condition. So it was not entirely acute, but it was an acute phase of a chronic condition.
So thank you, Dr. Shilpa. It's a wonderful presentation with photograph. See, in acute condition, this very difficult to do this one. Being it is a online consultation, that advantage was there.
Yes,
and,
yes.
So it was wonderfully recorded. And same again, these are the surgical cases. Okay, were treated with properly selected homeopathic medicine, where they could avoid the surgery, and with the simple medicines, so the boy could come out of the problem. Thank you very much. Even though the first indicated given remedy is not a from the plant kingdom, but she told why it was not in the initial belladonna, because she was felt that by the time medicine reaches, belladonna phase would have been just over. So Hepar is given, and I appreciate her frankness, promptness, telling what exactly she gave, and it is this thing recorded. Thank you very much for a beautiful case. So we saw 2 viral, and this is a bacterial infection. So beautiful presentation, doctor. Thank you very much. Now, because time is running short, I will not take much time. We will call upon one more speaker, our one more super faculty, Dr. Trupti Pai. She's a homeopathy practitioner from Bombay, and she is also a core committee member and our coordinator. And Shilpa and Trupti was there for almost managing our classes for last 2-3 years. Whenever it's online, these two people are managing most of our classes and coordinating wonderfully with the faculties and the students. So I call upon Dr. Trupti Pai. Here,
Thank you, sir. Thank you
instead
very
of
much.
case, she is sharing the importance of causation in the fever. Okay. Over to you,
In the
Dr.
beginning of the, thank you, sir. In the beginning of the session, Swami sir did tell about the onset and the importance of knowing the different factors that are related to fever. There are different factors which are very important when we handle a fever case. It can be an acute totality, a chronic totality. See, all fevers need not always be acute. There can be need not be always that a fever has to be related to weather conditions. There are other aspects also that can cause a fever. To make it simple, I just term causation with the mnemonic called as WEEP. One is weather. Now, weather, as sirs mentioned, that we have to understand what would have happened before the patient got a fever. The moment any child or a patient comes to you with fever, understanding the causative factor, what happened prior is very important. Like in the first case, Dr. Anusha showed that the patient, he came through bike and it was a rainy weather. So now you know he was drenched in the rain and it was a rainy weather. Similarly, there could be a patient where, he would have gone for a bike ride, nice, dry, cold weather. So there you know that, okay, that can be the causative factor. Or going to marshy land, you feel, okay, nice rainy season, let's go to Nandi Hills. Or people in Mumbai would like to go to Lonavala or Mathiran, any of these places you want to go for trekking and it's a nice, pleasant weather. So understanding what would have happened before getting the fever is important. So weather aspect I will not cover much because Swami sir has already spoken about different remedies, plant remedies which are related to weather, and most of you already know about it. The next, coming to emotional disturbance. Now, as I said, not all fevers are related to weather. Take an example. There's a child who failed in his exam. Okay. And now, because he failed, there are three things that can happen. Not always that because he failed, he's scared, or he can be scared, either he can be feeling bad, he can be sad, there can be grief, or he will feel insulted that in front of all his friends he failed, or the teacher would be very strict because he failed. So there are different scenarios when it comes to a situation of failure. So accordingly, the remedies also change. So just
You
because
tell
he
me
failed,
which is the remedy if they feel insulted? Huh?
Staphysagria.
Staphysagria.
Staphysagria, sir.
Your voice is breaking.
the staphysagria they are saying.
Staphysagria. Good.
Staphysagria.
Staphysagria. If they feel it is scared, fright, fear, for punishment, or from the parents or teacher. Aconite. Beautiful. Aconite. If it is from anger, due to anger. Chamomilla. Good. Chamomilla. Okay. Like these emotional factors will cause. It may be fear, it may be insult, it may be failure. Okay. It may be grief. Okay. That also the cause. Yes, Doctor.
Yes. Another situation of emotional disturbances. Now you get a patient, now there is no insult, there is no fear, there is no grief, there is nothing to do with the weather. But this patient has a low-grade fever with backache. And then when you ask more about that, how did it happen? What is going on in her life? She tells you that, you know what, my husband is not well, or my mother is not well, and I've been taking care of her for last few weeks or maybe for a few months, and then I'm really tired and exhausted. Again, there's another remedy which comes, ailments from nursing the sick. So once you know what the situation is, it's not necessary it has to be a fear, insult, or weather. It can be the situation also at home through what the patient is going through. So understanding that factor also becomes important. Then the next part is environmental. Now, as I said, people, you all can go for trekking. There can be a marshy land. You will get any sort of insect bites. Or there could be patient coming and telling, you know what, when I go to Bombay, I'm very fine. There is no problem. But the moment I land into Bangalore, I end up having a sneezing, and then that process starts with sneezing and that fever. So that's a non-stop cycle that occurs. So knowing the situation or knowing the environment in that particular state is really important to understand what could have triggered the problem. So understanding the weather condition, the environmental condition. Now the person goes for a party. Okay, you have an open lawn party, or you go for a marriage, and the food is really tasty. You tend to eat a lot, so overeating, or you wouldn't have liked the paneer or the cheese or the rich spicy food. So understanding what would have happened prior to the fever again helps. Like, it could be because of food poisoning, the person had a fever, or because of some allergic food. It can be because of some bites. So understanding that aspect also helps us come to a group of remedies which belong to the plant kingdom.
So few examples. So people can tell which is the remedy after eating fish, allergic to fish.
Someone says Apis astragus.
Apis, okay. Attica urans. After meat, arsenic. Arsenic generally for food poisoning, any food poisoning, this thing. Okay. After meat, fever after meat. No, not Naxomica. Mac carb. I don't know how many of this. Mac carb is a wonderful medicine if it is after the meat, eating meat. So after some bites, you all know bites, insects bites. Okay. 1 or 2 example already. Bites.
Caladium, sir.
Okay. Apis, madam. Good. Apis, madam.
There are remedies like ledum,
Apis smell, sir.
China.
Apis smell.
Apis smell. Beautiful. Food poisoning already I told. Okay. Good, good. Next, Dr. Trupti.
Okay, then now coming to pathological. Now, when we talk about pathological, it can be any of the bacterial infection, tonsillitis, pneumonia, urinary tract infection. So understanding about the pathology is also important when you treat a fever case. So as I said, fever can be acute, it can be chronic. Understanding the stage of the disease, understanding since how many days he has and what could have caused the fever really helps. Take another case, a patient, she's a nursing mother, and she gets a good amount of milk, and now there is stony hardness of the breast because of milk collection, and because of that she ends up having a fever. So then what would be the remedy?
Phytolacca.
Milk fever, good. One more, better than that.
Bariatakar.
Unable.
Bariatakar.
Attica
Very
urans.
good. Okay. There is stony hardness of the breast, unable to move.
Bryonia.
Excellent. So only when I say unable to move, you think of bryonia. Very good. Okay. So that way, understanding these different causations becomes important. So whenever you handle a fever case, it's always better to know what would have happened prior to it. And that will help you come to a group of remedies. And then from the group of remedies, depending on how you differentiate it, a simillimum can be found. Thank you, sir.
Thank you, Dr. Trupti. So Trupti madam is always like that. Huh? So wonderful presentation. And she given a beautiful mnemonics for the causation. Weep. Let us not weep. So let us fight with our homeopathic medicine. So actually fever is such a vast subject where it is covering within a limited time, like 1 hour, is very challenging and difficult. But we attempted few phases of it, and try to give the maximum utility to how to use the fever this thing with the plant remedies. Hope you all enjoyed this, got some benefit. Okay, so I thank all of you for the participating. It was a wonderful evening with you. So Dr. Sripad Hegde sir also came. Sir, thank you, sir. Thank you very much. So I saw Chirant also. Thank you, Chirant, for the attending. So I thank all of you for encouraging us. So again, we will meet on the next Wednesday.
Wednesday.
Okay. Thank you. Thank you very much. Good night.
Thank you.